Hi everyone, my name is Bong and I am a pelvic health and orthopedic physical therapist at Radiance Physical Therapy in Durham, North Carolina. At Radiance Physical Therapy, I treat runners with pelvic floor problems and busy parents with back pain, pelvic pain, as well as help postpartum and pregnant people continue living their life with less pain. Special thanks to Kinley for having me here today to tell you a little bit about what pelvic floor physical therapy is. So, first of all, you may be wondering, what is the pelvic floor? Do I have one, and do I need physical therapy for it? The pelvic floor is what we call the collection of muscles and ligaments and arteries that lives inside our pelvis. So I have a model of the pelvis here. On this pelvis model, you can see the white, which is bone, and all the red over here and in here, which is muscle. The pelvic floor muscles connect onto the front of our pelvic bones on the inside. They go all the way to the back side by our tailbone, and they even have connections onto our hips. It's really important to know that the pelvic floor does a lot of different things. They have a job in helping with our bowel and our bladder function. They have a role with supporting our pelvic floor organs. Everybody has a pelvic floor, and it doesn't matter your age, your gender, or your gender identity. Anyone potentially could have a pelvic floor problem. Some of the things that people mention when they have a pelvic floor problem include leaking urine when you laugh or sneeze. Maybe you're always going to the bathroom after you've just gone. Some people mention pain with sexual intercourse. Some people have issues with constipation or leaking bowel movement or leaking gas. Abdominal pain, hip pain, groin pain, tailbone pain, all can be related to a pelvic floor muscle problem as well. In the US, about 1/3 of women mention that they have a pelvic floor problem that interrupts their usual routine. More than 50% mention a pelvic floor problem that interrupts their ability to exercise they want. And about up to 50% also mention pain with sexual intercourse. So it's important to know that pelvic floor problems are really common, and if you have one, know that there's treatments, you can get better, and it doesn't have to interrupt your daily life. So a lot of people know about Kegels, and Kegels are actually not always the solution for pelvic floor muscle problems. Sometimes doing Kegels, which is just closing up the pelvic floor, that can actually make pelvic floor muscle problems worse. So the best thing to do if you notice or think you might have a problem with your pelvic floor that you would like help with is to really reach out to a pelvic floor physical therapist like myself and get a customized plan. And just like a tennis player, a marathoner, and a weightlifter would have all different training plans for the demands of the sport, the same thing goes for our pelvic floor and our bodies. All of our bodies are different and we all have different needs. And the best thing to do to address a pelvic floor issue that you may have is to get a personalized treatment plan and a customized evaluation with a licensed physical therapist like myself. So I hope that answered any questions you may have. Thanks so much for having me here today, Kenley. And you guys can connect with me at radiancept.com.